welcome to our postpartum segment of Nesting School. I'm Sarah Griffith, and today I'm going to be talking to you about some of the products that you might want to consider having on hand for once the baby gets here. What I'm going to tell you is all related to a vaginal delivery. If you're having a C-section, I don't have advice for you because I haven't had one myself. So my advice is to do some research if this is your first time and you know that you'll be having a C-section. And I don't think that it would hurt to do some research on it anyways, just in case, because we really never know until we go into labor how the baby is getting out of you. So I will tell you very quickly, I'm going to tell you quickly a little bit about my son's birth, and then I'm going to get to talking to you about some of the products that I have purchased for round 2 that I didn't have for round 1. So my labor was very easy. I had my son in a total of 4 hours. I went to the movies, about 9:30 showing. I came home and I went upstairs and I had lost my mucus plug. So when I got home from the movies, it was like 11:30 and I remember yelling down to my husband, "I'm going to have this baby tonight." And he's like, "No, you're not." So anyways, I said that, and then within probably an hour, I went into labor. I started to have contractions, but because we were new to this and we really didn't know what we were doing, my husband remembered from the labor class, he would feel my belly, and he said, "Feels like Braxton Hicks. They told us that your whole stomach would be hard. Only some parts feel hard, so I don't think it's real." And so I was like, okay, I guess it's not real. So I just kept putting it off, and the contractions started to get stronger and faster. And so then, of course, because I'm new to this, I called my mom and I told her what was going on, and she said, "Are you timing them?" And we were like, "No." Clearly newbies. And so she's like, "You need to start timing them and you need to call your doctor." And from that window of time, I went into transition. So the contractions started to get quicker and quicker, and I actually started vomiting, and I did most of my laboring at home. We called the doctors. They had us rush to the hospital. When we got there, I remember going in through the emergency room because it was the middle of the night, and they wheeled me up to the labor and delivery room, and I remember getting in there and just being on the floor in pain. And the nurses were just looking at me like, "This girl's going to be dramatic. This is going to be a long night." And I remember they checked me, and they were like, "Oh, she's 6.5 centimeters. We need to get her ready." And so it went from 6.5 centimeters to 8 very quickly, and at that point, they told me that I couldn't have an epidural. They said, "You're running out of time. He's coming pretty quickly," and that's when I actually panicked. I was doing fine. It was painful, but it was all tolerable. But then when they said no, because originally my plan was the epidural, when they said, "No, you can't. You're not going to probably be able to get it," I freaked out. And so they did still administer the epidural. They gave it to me when I was 8 centimeters. Ladies, it really didn't touch any of the pain until basically once he got here. And so then, obviously, you can't really move too much afterwards. So I had the epidural, but I would say that 80%, 85% of my labor I did on my own. My son was born at 2:43 a.m. So you figure I came home from the movies at 11:30, went into labor probably 11:30, 12 o'clock. So very quickly, he did his process. And because he came so quickly, I will tell you that my recovery time was really hard. I didn't have any tears. I did not have an episiotomy, but the swelling, because of the amount of pressure so quickly, was unreal, to the point that I had to sit on a donut. I had to have, down the road, I had to have some of the skin down there cauterized. It was just kind of a lot. I'm hoping, and the way that I was stitched wasn't great, I'm just hoping that this time around, I can act, and I don't want to be in labor longer, but I'm hoping that this time around, the labor isn't so quickly that causes such a painful recovery. So you never know what you're going to get. There's lots of tips out there to make your delivery easier. As far as, down there goes, you can research it yourself, but what I wish I would have done is I wish that I would have had some of these products that I bought now on hand afterwards. Now, the hospital is going to give you a lot of this, not this stuff, but a lot of stuff. You're probably going to go home with a donut, depending on how your delivery was. So something for you to sit on that helps. You're going to probably come home with a peri bottle, which you can use when you try to go to the restroom down there. You just kind of squirt it while you're going, and it helps to ease that burning and the pain. You'll probably come home with a little tub. I had like a little wash tub, and that was the same thing. It was for that, they call it a sitz bath, so it was for you to do your sitz bath in. I came home with a spray called Dermaplast. It helped with the burning down there, and it also helped with the healing. So most hospitals will leave you with Dermaplast. It worked well. They also gave you witch hazel pads to take home. Those were great. At the hospital, they encourage you to take a stool softener. If you haven't already done so, they can give you one at home, or you can take one once you get there. I'm trying to think what else they left you with. They're going to give you these really great underwear. They're hideous. They look like mesh shorts. Keep those. Take them with you. Ask for a few extra pairs. You'll actually want to wear them for the first few days after your delivery, even when you're home. So I'm thinking. It was 5 years ago, ladies, so I'm trying to think. I feel like that was everything that they gave me from a postpartum standpoint. Again, it was really painful after the fact. The whole doing it, I was fine, but the healing was really hard. So what I did is I worked to order some things for myself to kind of get me through postpartum stuff. This is not postpartum, but this is something that I've been drinking to help get my uterus ready. This is third trimester tea. This is for moms who are in their third trimester. It's called Red Raspberry Leaf Tea. I like the Earth Mama Angel Baby Organics brand. You're going to see me have a lot of this stuff because I really love the brand. But it's not, there's lots of other brands out there that would be Red Raspberry Leaf Tea. Check with your doctor, obviously, before you start drinking this. With any of this stuff, check with your doctor and not a doctor, just a mom. But anyways, this is something that I bought that I'm drinking right now. So what else do I have? Okay, this seems really silly. All I can say is thank goodness for Amazon, because I would not want to be buying all of this at the store. These are Depends. I bought myself a box of Depends, and I know I'm only 30 years old. I should not have to be wearing Depends. But here's the deal. Everybody told me, remember how I told you about those mesh underwear? Everybody told me that Depends are like the secret way to go. I didn't do this for the first time. I didn't know it. So they're lovely looking. They look like an adult diaper. Well, they are an adult diaper, but basically then you don't have to wear a pad. You can just wear these, and it'll, keep everything in down there. I've heard great things. Again, I did not use Depends last time. I only used pads, but I'm willing to give it a try. So I have these on hand. I won't take them with me to the hospital, because at the hospital I will wear those shorts that they give you, and I'll just wear some of the pads from the hospital. So you're going to want to stock up on pads as well as possibly Depends. You can ask your husband to go get that one for you. They're going to tell you to have a stool softener for the first few days until you have a bowel movement. A lot of people have told me that dates are really helpful leading up to the delivery to have. So you may want to grab yourself some dates and start eating those. But I got the Philips stool softener. I don't ever use stool softeners, so I don't really know exactly what brand's great, but I just bought these knowing that the hospital is going to tell me that I need to take some when I get home. So you may just want to buy yourself a bottle of them so that you have them when you come home. All right, what else do I have here? Okay, so I am new to this. Didn't use it before, but Earth Mama, they have a New Mama bottom spray, and this spray is like a cooling mist for you. Basically, when you go to the bathroom, you're going to use this. You're going to spray down there after you go to the bathroom or after you take a bath, if for some reason you're taking a bath. And they say, this is really bizarre, but I'll read it to you. It says that whatever's left in the bottle, you can use as a cooling facial toner or aftershave. I don't know if I'll be using this on my face, but nonetheless, that's the spray. It's like a lavender cucumber. That's the scent of it. And then this is a little bit more heavy duty. Basically, this is like a healing balm that you could use for any kind of tears, hemorrhoids. Just like it's also going to give you that soothing and cooling feeling. Also, this one's a lavender mint, so that's where that cooling's coming from. So this is New Bottom Balm, and not New Bottom. I'm sorry, Mama Bottom Balm. They have New Bottom Balm for babies, and then New Mama Bottom Spray. So those two go hand in hand. I have read that of the two, honestly, this one is a little bit more, it's a little bit stronger, works better. Both of them have pretty good reviews though if you look online. They also have this stuff. I'm excited to try it. It is the Postpartum Bath Herbs, and this is how you make those. If you've ever heard of anybody making a padsicle, it's like a popsicle, but it's a pad. Obviously, you're not eating it, but you can look it up on Pinterest. Trust me, there's tons of directions and recipes on how to make it. But basically, a padsicle is it's a pad. It usually has on it aloe vera or witch hazel. You freeze them in the freezer, so you're gonna want to do these maybe like the week before or whatever. That way, when you come home, you have these pads that you can wear down there for a little bit, and it will cool it. In the hospital, they'll probably give you ice packs in pads down there to help with your swelling. Those are nice, but when you get home, it's nice to have some things on hand. So this is basically, these are like bath herbs, and you're going to use them down there to give you a little bit of a better feeling, I guess, to help with your postpartum feelings. But what you can do too is after you use this, you can squeeze, and maybe probably before, you can squeeze some of the water and you can put it over the pads and then freeze it so that you can make the padsicles with it. So this is just a bath, for a sitz bath, but if you wanted to use it after the fact, you could to make the padsicles too. So this box comes with 6 different treatments for it, and I would say 6 is fine. I don't think you'll need more than 1 box of this, but this is called the Postpartum Bath Herbs. Okay, this is comfort tea. This is monthly comfort tea, so you're really supposed to drink it during your menstrual cycle, but they recommend drinking it, I think it's, 2 to 4 hours after birth. Where is it? It says it on here. I don't know. I'm sorry, I should have looked at this ahead of time. Basically, like an hour or 2 after birth, they recommend that you drink it every 2 to 3 hours to help with the pain that you're going to have in your uterus, the cramping. If you've never had a baby before and this is new to you, you're going to experience a lot of cramping, a lot of bloating, a lot of gas afterwards. And the doctors are going to be checking, the nurses are going to be checking to make sure that everything's going back down. They're going to be pushing a lot on your stomach and on your uterus. You may have gas while they're doing it. It's really normal, actually. But anyways, supposedly this tea will help you to feel better. And then this is something that I didn't have for my other one. This is highly recommended by a lot of midwives. The brand that I bought, it's called Wish Garden Herbs, and it is a supplement. I just got the smallest bottle. It's called After Ease. You can see it right there. And it's supposed to help with afterbirth pains. So again, that same feeling in here. I have not opened it to even try it yet, so I don't know what it tastes like. If it's like any type of herb, it probably doesn't taste all that great, but you're supposed to mix 2 to 3 drops with water and, drink that pretty often right after you have the baby. So this will come with me to the hospital as well as that tea. They'll go in my bag. These are definitely more holistic approaches to pain management. You may find that your doctors or your nurses think that you've lost it, that you have these herbs and these teas, but hey, I say whatever works, and especially if it's a more natural route. So I'm taking it with me to the hospital. Now I'm going to switch gears and talk to you a little bit about if you're breastfeeding. I had a borderline malignant phylloides tumor in college. So they sort of told me I've got like a 50-50 shot of breastfeeding because I had 2 partial mastectomies and also a surgery on my right side. So I wasn't sure what the milk production would be like, but I was actually able to nurse my son. So every time I nursed him, I always got less on one side. So if I were pumping, I would say that I'd get, if I got 4 on this side, I'd get 2 on this. So it was always less, but I was still fortunate enough that I was able to do it. So I'm proud of that, and I'm hoping to be able to do it again with my daughter. I say hoping because you really never know until they're here. So my advice to you would be to get ready for all outcomes. Get ready to be, if you want to exclusively breastfeed, get ready for that. But you also need to be ready that you might need to pump. So I'll tell you, when my son was born, he wasn't latching. It seemed like he wasn't getting enough. Like, it was just really frustrating. And I remember the night that we came home from the hospital, it was like 2 o'clock in the morning, and I was frazzled. I was like, I'm worried. He needs to eat, but I don't want to give him formula. And so I sent my husband to, I think think it was Walmart, because they're 24 hours a day. I sent him to Walmart. He came home with a breast pump, and then I used it, and I knew he was getting food. But to be honest with you, I wasn't ready. I didn't have a pump because I didn't think I was going to need a pump. I thought I was just going to breastfeed. So as much as, maybe you just are going to do that, and you might be lucky enough, you may want to have it on hand, even if it's just a hand pump. Your insurance will probably cover it, though, for the most part, if you have insurance. So anyways, be prepared for that. You're going to want to have some bottles just in case you are pumping, and you're also going to, I think you should have a tub or two of formula on hand just in case you need it and it's 2 o'clock in the morning and you're freaking out. I don't think it hurts to have options. So I have, a couple tubs of it in the pantry ready so that in the event that I need it, I have it. But some will tell you differently about breastfeeding. Some have very strong approaches or opinions on it. I just think it's important that the baby's fed. That's my biggest worry or biggest concern. So my goals are to breastfeed exclusively, but you just don't know until they get here. So with that being said, I have my pump ready to go. I have something, all of you are going to, especially if you're a new mom, you're going to want to have breast pads. I like the washable ones. The brand that I have right now is called Boobies, and it's washable bamboo nursing pads. These ones are actually shaped like hearts, but you just put them into your bra, and then they help with any leakage. There's so many brands out there. You can find one that you love, but I will just tell you that I like the washable much better than the disposable. Some people recommend that you have some like cooling pads in case you have some issues. These are Tender Care Hydrogels. They're for sore nipples and just the soreness that comes along with breastfeeding. So you may want to get these. These are like a gel pad. I also have, I'm excited about these. I didn't have these with my son, but these are by Earth Mama, and they're called Boobie Tubes. Or Boobie Tubes, sorry. And they got really great reviews. So these are filled with chia and flaxseed, and they are heatable or freezable. So you can put them in the microwave, or you can put them in the freezer. And they're going to help you when your milk's coming in. They're going to help you to feel comfort, but they also can help if you encounter mastitis. So you can use these when that happens. And whenever you're done breastfeeding and you're trying to dry up, you can use these to help with that. You can freeze them and it'll help. So I think they're a nice little investment. These were a little bit expensive, maybe $15 or $20. But now I have them, so I'm excited about that. So that's what these are. And then you're going to want to have a lot of people think that lanolin's controversial, so I like to stick to the more natural side of things. A lot of my brands that I buy are organic, and this one is Natural Nipple Butter, also by Earth Mama. I also have the Honest brand kind. Last time when I had my son, I used the lanolin Tender Care. It was fine. Back 5 years ago, I don't want to say I didn't care about this kind of stuff, but it wasn't my thing. I just, I didn't know better, so I just used whatever. Now that I've done some research, I sort of am trying to stick away from those types of products. And so this time, I'm going to use a more natural nipple butter. So this is the kind that I've bought. This one has gotten killer reviews online. So anyways, maybe something to think about. In addition, I have this milk tea. It's Mother's Milk Tea to help promote lactation. And I have, this is the pillow that I used for my son actually, but I just bought a new cover for it. This is the Boobie pillow. It kind of goes around you, and then the baby can sit here and you can nurse. I don't really care what brand you have, but I will say you're going to want a pillow, a nursing pillow. My breast friend is pretty popular. Bobbie is not actually the most popular anymore at this point. I think it was 5 years ago. People really recommended it, but now there's so many other options. So you may have something that's better than this one, but I think what matters most is that you have something just so that you're comfortable. And I would take this with you to the hospital. It will help with your transition into breastfeeding. So anyways, thanks for watching. I'm sorry this video was so long, but I hope that you found it helpful, and go ahead and share below any other suggestions that you have to help make postpartum care more comfortable and easy. Have a good day. See you all.